Hi, let's see an NCLEX RN video based on care of pre-operative patient. First question, you are preparing a patient for surgery and have asked her to verify her information on her patient identification band. She tells you that the birth date is incorrect on her identification band. The most appropriate action by the nurse at this time is which of the following? Cross out the birth date and put the correct one in its place with the nurse's initials. Ask the family members to validate the patient's birth date. Call the surgeon's office to validate the birth date and ask the admissions office to please send a corrected identification. So here the patient is getting prepared for a surgery. You know that during the surgery and post-operatively also the nurse need to check the identity. So if there is a problem in the identification band, it will affect in identifying the patient. So you need to ask the admission office to please send a corrected identification band. Second question, the nurse should report the following findings from a patient's history as an increased risk for DVTs post-operatively. Select all that apply. History of smoking, age, history of deep vein thrombosis with previous pregnancy, borderline hypertension, and allergies. You need to know that history of smoking causes vasoconstriction in a patient that can lead to deep vein thrombosis. In vasoconstriction, the vessel size decreases, which lead to platelet and RBC clubbing and lead to deep vein thrombosis. So, history of smoking is an increased risk for deep vein thrombosis. Anytime there is a history of DVT, the patient requires prophylaxis before surgery. So history of DVT with previous pregnancy also can lead to a DVT post-operatively. And the body, when you're seeing in hypertension, that causes injury to the vessel walls. So at that time, the body will be placing the platelets and RBC over this injured vessel walls to protect the area. This also can turn to deep vein thrombosis. Allergies and age, they are not implicated in clot formation. Which of the following patients presents the greatest risk for a negative response to anesthesia? A 40-year-old male with high BP, a 20-year-old female with no prior surgical history, a 29-year-old female with a history of stage 2 acute renal failure, an 85-year-old male who drinks 1 glass of scotch every night. Any patient with renal impairment, they will not be able to excrete the anesthesia effectively. Anesthetics, they are excreted either through the liver or kidneys, and impairment of any of these organs will mean the patient cannot get rid of the anesthesia from the body. The anesthesiologist must thus reduce the amount of anesthesia used during the surgery when the patient is having a problem with their liver or kidneys. So here, the 29-year-old female with history of stage 2 acute renal failure is at greatest risk for a negative response to anesthesia. During the initial assessment and admission questions, the nurse asks for the time of her last oral intake. The patient replies, I had dinner last night at 8 p.m. but I took few sips of water this morning with my vitamins. The nurse's best response is which of the following? Explain to the patient that just a sip of water should not be a problem for anesthesia, but the vitamins may be a problem. That information will be passed on to the anesthesiologist. Tell the patient that the sip of water is not an issue because it was only a sip. Third, inform the patient that her surgery will not be performed today because the risk is too high for a negative outcome. And fourth, inform the patient that taking her vitamins before surgery was a good plan. Patients are very often told to take certain daily medications with a sip of water early in the morning of surgery by anesthesiologist. The anesthesiologist will warn the patient to have any hypertensive medications or corticosteroids if they are taken in a routine basis. The anesthesiologist will view the vitamin as a non-essential medication and may wish to give other medications before surgery to help the stomach empty. So it is imperative to give the anesthesiologist this information. So the first option is correct. Sips of water is okay, but vitamins may be a problem, so that information needs to be given to the anesthesiologist. Surgeon has asked that thromboembolic stockings be placed on the patient before surgery, as well as sequential compression devices on both legs to the knees. Patient asks the nurse what they will do for her, which response by the nurse is most appropriate. They work together to make sure that you do not have a decrease in arterial blood flow in your legs during the surgery. They complement each other to prevent blood from backing up in your legs and causing a deep vein thrombosis due to your immobility during the surgery. They prevent deep tissue clotting during the surgery. The two devices do the same thing, but one is better during the surgery and the other is better post-operatively. So you need to know that thromboembolic stockings compress the superficial vessels in the legs and they force the blood to flow through deep vessels, thus preventing deep vein thrombosis. Also, the sequential compression devices, they push the blood through the blood vessels in an upward motion, which help prevent venous stasis and deep vein thrombosis. So here the second option is correct. When planning discharge education for a 65-year-old male who is having a hip replacement, it is appropriate for the nurse to consider which of the following. Select all that apply. The patient's resources at home for completing activities of daily living, the number of stairs in the patient's home, transportation to follow-up appointments, pre-existing medical conditions, the number of bathrooms in the home. So, when the nurse begins to make plans for the patient's discharge to home, it is very essential to think about if they will help with the activities of daily living. So, the patient should have enough resources at home to do the activities of daily living. If it is not there, the patient may need to spend more time in the hospital or they need to be discharged to a rehabilitation center for a short time. The second one, if the number of stairs are more, then the patient may require again rehabilitation center before returning to home. And also transportation to follow-up appointment will also impact the ability to go home or to a rehabilitation facility, as follow-up is a key component to successful transition out of the hospital. Pre-existing medical conditions, the patient post-operatively also, it may require visiting the nurses to follow up as well as to track the pre-existing conditions. So the nurse need to know about the pre-existing medical conditions of the patient also. To prevent circulatory complications in the immediate post-operative period for a patient who has had an explorative laparotomy, which nursing action is of the highest priority? Administering pain medication, applying anti-embolism stockings, encouraging coughing and deep breathing every 2 hours, monitoring vital signs every hour until stable. So the priority for this patient is the monitoring of the patient's vital signs. The other responses are appropriate, but they are secondary to assessment of the vital signs. What interventions can the nurse implement to prevent surgical site infections? Select all that apply. Appropriate use of narrow spectrum antibiotics, appropriate surgical site hair removal before surgery, maintaining glycemic control, maintaining normal body temperature, proper maintenance of sterile field. So according to the recent data from the Surgical Care Improvement Project, indicates that all of the listed elements except the first option are critically important in preventing surgical site infections. So as for antibiotics, we have to use broad spectrum, not narrow spectrum antibiotics, and we should also use prophylactic antibiotics which are appropriate for the patient. And we need to remove the hair before the surgery from the surgical site, maintain the glycemic control of the patient, maintain normal body temperature, and sterile field should be maintained. The Trendelenburg position is used for which type of procedures? Procedures on the heart and lungs, procedures on the lower abdomen and pelvis, procedures on the head and neck, gynecological procedures. So here you need to know that in Trendelenburg position, the patient is supine on the table with their head declined below their feet at an angle of roughly 16 degree, and this position is used mainly in surgeries of lower abdomen and also when we are placing the central venous catheter. So here the procedures on the lower abdomen and pelvis is the answer for using the Trendelenburg position, because it takes the pressure of the lower organs, especially in the lower abdomen and pelvis. So it is not appropriate for procedures of the chest, because it will be increasing the pressure on the heart and lungs when we are using the Trendelenburg position. And head procedures usually is done in Fowler's position, and the neck procedures varies with the procedure, like anterior or posterior approach we will be using, and gynecological procedures are usually done in lithotomy position. What is one airway complication that can occur when the patient is receiving anesthesia care? Is it a myocardial infarction, cerebral vascular accident, hernia, aspiration? Aspiration is a direct risk when receiving anesthesia due to the patient's inability to protect his or her airway. Know that cerebrovascular accident and hernia, they are unrelated to anesthesia. Of course, the stress of surgery, especially in patients with comorbidities, can result in myocardial infarction, but here in this question, the airway complication is aspiration. Which is a common IV anesthetic? Is it propofol, ibuprofen, clotrimazole, diphenhydramine? So answer is propofol. It is an anesthetic with quick onset and offset characteristic. Patient wake quickly after the drug is discontinued. Clotrimazole, it is an antifungal medication. Diphenhydramine is an antihistamine, and ibuprofen, it is a non-steroidal anti-inflammatory drug which is used for pain and inflammation. So the IV anesthetic is propofol. Maria is admitted for her total abdominal hysterectomy. She is a 40-year-old with two children aged 4 and 6 years. She has a history of fibroid tumors and deep vein thrombosis with her most recent pregnancy. During her initial assessment, Maria informs of her allergies to penicillin and latex. She has smoked 10 cigarettes a day for the past 20 years. And her vital signs are BP 140 by 88 mm of Hg, heart rate is 80 beats per minute, respirations 20 per minute, temperature 98.7 degree Fahrenheit, pain score 0 out of 10. Maria expresses concern for her stay at the hospital and her upcoming procedure. She expresses anxiety. Maria's nurse completes the pre-operative preparation. An IV is inserted, and normal saline is started. The anesthesia provider is reminded of Maria's allergies to penicillin and latex and smoking history. Once completed, the nurse spends time with Maria attempting to allay her fears by explaining what to expect in an operation room and when she wakes up. So this is the case scenario. First question, Maria expresses her anxiety about the procedure and anesthesia to her nurse. The most appropriate response is, tell her that it's okay, we do this every day. Second, assure her that her fears are normal and encourage her to use her consultation time with the surgeon and anesthesiologist to address her concerns. Third, share a story about your friend who had similar fears prior to her surgery. And last is documenting her concerns in the chart so that the post-anesthesia care unit nurse will expect her to be anxious during recovery. So here it is important to ensure that all of the patient's concerns are addressed before surgery. So the answer is assuring her that her fears are normal and encourage her to use the consultation time to address her concerns. So if we are just sharing the stories or simply talking or documenting, it has no impact on patient's anxiety. She needs to have her specific questions answered so that she can feel comfortable that all of her concerns are important to the physicians. Maria is allergic to latex. What is the appropriate action to prevent an allergic reaction in the patient who is having surgery? Terminally clean the operation room before her case and remove all the latex products. Maria should be the first case of the day and only non-latex items should be used. All surgical suits are latex free, so this is not a concern. Fourth, anesthesia should be prepared to intubate and treat her if a reaction occurs because there is no way to ensure a latex free environment. So here you need to understand latex allergies are increasing and require special care in the operation theatre. Latex allergy patients, they are usually scheduled as the first case so that the room will be completely clean and all latex items are removed from the room. The key to this is that the patients in the preparation of the area, there is no latex items in the room. That also we need to ensure. So the second option is the correct one. Because of Maria's smoking history, the nurse understands she is at great risk for which of the following. Select all that apply. Increased post-operative pain, difficulty with anesthesia, respiratory depression during the procedure, increased healing time after the procedure, deep vein thrombosis after the procedure. So here you need to understand two things. Smoking puts the patient at risk for respiratory depression, also for deep vein thrombosis and increased healing time. So this is for smoking. And if the patient was an alcoholic, that might have posed problems with anesthesia and post-operative pain that is increased. So that's for alcohol and this 3 is for smoking. The nurse recognizes teaching has been effective by which of the following statements? My neighbor was able to eat right up to the time of her procedure. I know there is nothing you can do about nausea about the procedure. So that IV line will stay in throughout the procedure. I know I will need blood during this procedure. So an IV line is typically inserted in the pre-operative area and that will be staying throughout the procedure. Blood is not always necessary. Nausea can be treated and patients should be NPO before operative procedures because there are chances of aspiration. What is the priority responsibility of Maria's nurse before the procedure? Explain the procedure and have Maria sign the consent form. Review the risk of anesthesia. Mark the surgical site with the patient. Ensure completion of the pre-operative assessment. Here, the nurse has to just ensure the completion of the pre-operative assessment. All other things like taking the consent, reviewing the risk for anesthesia and marking the surgical site, they are to be done by the physician. Hope you understood this video. Thank you so much.